So this thing is a sacrum. A sacrum is kind of like the coccyx. It's a big coccyx in a way. It has a base up at the top, and it has an apex down here at the bottom. And we got some parts on it. Remember when you're a little kid, there's actually 5 vertebrae here. You could call them sacral vertebrae. And then as you get older, they fuse together by the age of about 20. And you can't normally see the fusion lines, or you can't see the discs anymore after about the age of 20, but you still can see this line right here. I don't know if you can see that okay. That's called the transverse line or transverse ridge or linea transversalis. I think we talked about that in lecture already. Let me try to zoom in a tad bit now that you get the bird's eye view of it. So you can see this would be the S1 linea transversalis. And oh, it sounds like it's going louder. I can actually read the chat, so that's kind of neat. Linea transversalis of S1, S2, S3, S4. S5 really doesn't have one. It kind of does have a little bit here, but that connects to that disc, that sacrococcygeal disc. But so if you see like number 4 right here on the test, after the transverse line. So that's pretty easy. If I have number 4 right here, so these are vertebral bodies. This is the S1 vertebral body, S2 vertebral body, S3, S4. Oops. S4 is right here because you can see the line above. You can also see this line, and this would be the S5 or sacral body right in this region. So 1, 2, 3, 4, kind of short in this person, and then 5 would be right here. We also have some holes. Okay, so these are the, I don't know if I should blow this thing up a little bit, but these are the, let me go back to a little bit bigger view. You can see the whole thing. All right, so these are sacral foramen, but specifically these are the anterior sacral foramen. There's 2 at each level. You should definitely know who comes out of those things. So that's the ventral ramus that comes out of these. S1 ventral ramus, S2 ventral ramus, S3 ventral ramus, S4 ventral ramus, and let me cheat and look over on the back. So we would normally have a ligament. You guys remember the name of that ligament? Sacrococcygeal, lateral sacrococcygeal ligament, which would run over this away, and then the S5 ventral ramus would come out right in this space made by the ligament, and that didn't happen. All right, what else we got? So we have this space. We're just moving laterally now. So this space right here, let me actually blow it up again to zoom in on that. This is easy to remember. So just this region right here, that's called the bone bar. You could also call it the costal elements. Costal elements or bone bar. That's the costal elements. Same thing here. Costal elements or bone bar. Costal elements are bone bar. And those, kind of interestingly, are costal, gives it away what they are. They're derived from costal embryologic tissue. There's obviously no ribs here, but during formation, this would have become a rib if it was up in the thoracic spine, the same region. So costal elements or bone bar. If you move out even more laterally, out into this area, this is called the lateral mass. So this is all lateral mass. Back out a little. Right? So lateral mass of S1 is up here. Lateral mass of S2. Notice the lateral mass of S1 goes all the way down here, and it meets S2 about in this region here. So that's lateral mass, lateral mass, lateral mass. This region up here, let me kind of turn it to the side. Let you take a look at this. Hopefully this will come in. But see all of this? That's the lateral mass of S1, all of that, but it has a special name. That's called the ala, the sacral ala. So all of that, sacral ala. Who cares about that? That's where part of the sciatic nerve travels. L4 and L5 actually come together and travel over the sacral ala, right in this region. You could still call it the S1 lateral mass if you wanted to, but you should call it I would call it the sacral ala. It's got its own kind of name here. All right, and that is it. The front of this thing is pretty darn easy, I think. And the back is a little more challenging. That's actually why let's flip it over to the side. I think we look at this a little more next week too. But now you can see the auricular surface of the sacrum is right here. Okay, we'll talk about these impressions right here next week. But let's flip it over to the back, get a bird's eye view, and I'll probably blow this up a little bit. So we have some parts here. These bumps right here, and this is kind of a weird one. Let's actually switch, because that's kind of a strange one. Let's look at this one. This is you see this kind of ridge, this mountain range right here? That's called the median sacral crest. Median sacral crest. Not the medial sacral crest, but the median sacral crest. What makes up the median sacral crest? Well, God, these look like spinous processes, don't they, of the lumbar spine? And that's kind of what they are. But you can call them sacral tubercles. You shouldn't call them sacral processes, though, because they're smaller than the spinous processes. So we always call them sacral tubercles. So this is the S1 sacral tubercle. Let's blow up and take a look at that. So there it is, sacral tubercle of S1. If we drop down, sacral tubercle of S2. Then we drop down, sacral tubercle of S3. And what happened now? What happened? Where's the sacral tubercle of S4 and S5? Well, they're gone. And this is actually, well, it's normal in humans, but if you see it anywhere else except these lower two levels, it's not normal. And that's called a spina bifida. Spina bifida, which we'll talk about more in lecture, occurs when the posterior or the neural arch fails to fuse for whatever reason. And there's a lot of bone missing here. The lamina, some of the lamina is missing, and the entire sacral tubercles are missing. So this gives rise to what is called the sacral hiatus. The sacral hiatus. I can actually stick this probe all the way through here. Oops. Let me back out and let you look at that. Okay, you ever heard of a caudal epidural steroid injection? You will, once you get on in practice. But this is the same route as a caudal. You can take a needle and you can put it up here, see the tip way up here? And people who have suffered a lot of scar tissue after surgery, sometimes, and they need a cortisone injection or an epidural steroid injection, this is sometimes the only way that you can get into the L5's epidural space to give them a steroid. All right, so I'm going through the sacral hiatus and going through the sacral canal. I could do it the other way. You could see the probe kind of come out here at the bottom. All right, so that's pretty cool. So we have all of us have a natural spina bifida. Sometimes in fact, more normally, it's two-level spina bifida. What do you think of this one? Let me blow it up on that area. What do you think of that? Guess I could blow it up even more. I don't know how, let's... Yeah, that's messed up. Well, it's not messed up, but some people, still quite a few people, but some people only have a single level spina bifida. So I can still count, if I back out, I can still count 4. I can count 4 spinous tubercles here on this one. So there's 1, 2, there's 3, and there's 4, and there's a hole. All right, so we're missing the S5 sacral tubercle. Now let's zoom in on this. I don't know if I talked about this in class or not, but let's zoom in on the first sacral tubercle here. And what do you think this, anybody notice anything wrong with that? Oh, I see a question too. It's really tiny. I have to walk over there and look at it. While you're looking at that, let me walk over. Oh yeah, so spina bifida is the opening or the arch. Spina bifida is the opening. A spina bifida. Well, spina bifida is a condition. And spina bifida means that the neural arch or the vertebral arch failed to turn completely to bone. And it's diagnosed when you see a defect, a closure defect. Like this level. Well, let's look at this one. What do you think of this? Let me see. Yeah, so the spina bifida it presents as the opening, but it's not the opening. The spina bifida is a condition where the posterior arch, the posterior part of the bone, doesn't, or the vertebral arch fails to close like it's supposed to. Okay. I don't know if you can see that or not, but there's a crack right there. And this is what you'll see in your x-rays. There's a slit right there. And yep, so this is spina bifida occulta, most likely. This is definitely occulta. And we'll get into the classifications of spina bifida, but occulta is the most common, and that means that it's like an OHM. It's an incidental finding. It's probably not even worth telling the patient about it because there's no way any nerve roots could herniate out through that thing. Because, and even with spina bifida, a problem, remember the first week we saw spina bifida, the problem occurs if the thecal sac herniates out through that opening and gets pinched and tangled. And then there's some types of spina bifida where the thecal sac doesn't even form, and it's just like your nerve roots coming out of there. Maybe some skin over them, maybe not. So that's the story. So that is an unnatural spina bifida on this bone right here. Everybody good with that? Let's go back to our bird's eye view. All right, so 3 mountain ranges. Let's talk about them again. So this one right down the middle, that's the median sacral crest. Then there's one on the there's one that's really hard to see. Let's go right to the lateral sacral crest because you can see these bumps that make it up. There's one there. There's one there. And there's the tip of my probe is pointing right to it. And there's one there. So that's called the lateral. Collectively, these bumps are called the lateral sacral crest. All right, let's look on this side. I can blow it up a tiny bit to show you some of these. Okay, so lateral sacral crest over here. There's a bump right there. And these are hard to see. This is where it'd be nice to be here where you could feel and look at this because they're pretty small. There's a pretty good one right there though. See that? If I turn it maybe to the side a bit. See it right there? So that makes up the lateral sacral crest. The lateral sacral crest, those bumps have names as well. So those are called because they're made by transverse elements, the fusion of transverse elements, these are called, oh, that just escaped my mind. They're called, I got it, transverse tubercles. Okay, so these bumps that we just looked at are called transverse tubercles. There's one there, and there's one there. So, median sacral crest in the middle is made up by spinous tubercles. Lateral sacral crest is made up by transverse tubercles. And you thought these were hard to see. Medial to these sacral foramen, which we'll talk about in a second, there's really subtle bumps. Right there's one. There's another one. Kind of hard to see up here. So those are called articular tubercles. And they make up something called the intermediate sacral crest. Intermediate sacral crest. Let's look on this side. There's a nice one there. I don't know if you can see that or not. But there is a bump right there. Let's just for fun, let's see how. Let's really zoom in. Hopefully it'll know what to focus on. So there it is. We might be too close. But there it is, that bump right there. So that's an articular tubercle. They're medial to this hole. This hole, by the way, it's a sacral foramen, but it's not the anterior sacral foramen. It's the posterior sacral foramen. All right? And they're medial to the posterior sacral foramen are the articular tubercles. So there's one there. This is a really nice one you can see. If you have a chance to, if there's any chance to see it, that's it right there. Right? So articular tubercle. All right. The other concept, probably have to back out a little bit on this. Okay, if we look down, okay, do you guys know where you are? Do I need to back out to show you? So there's the front of the sacrum, there's where it connects to the coccyx. Now if I tip it towards you, now we have a S to I, superior to inferior view, or an axial view. We can see some stuff here. We'll actually talk about this in class today as well. Let's see. Yes, it can be called the sacral tubercle or the spinous tubercle, either one. But don't say process. Sacral tubercle or spinous tubercle. I prefer sacral tubercle. That leaves no doubt that you're talking about what you're talking about. Okay? So here's the sacral base. That's S1. There's a ring apophysis, a growth plate that is fused. It's right there. You can look down the sacral canal. I can drop my probe right down there. Sacral canal. But now you can see kind of the roof. It's called the roof of the sacral canal. It'd be this piece right here. So there's one on this side. So this piece of bone, I can drop it down a little so you can see. That's called the sacral lamina. The sacral lamina, just like it would be in the lumbar spine. Sacral lamina is right here. Two sacral lamina fused together. Some authors say the spinous process is in there. Some authors say the spinous process comes off the fused sacral lamina. That's actually the one I'm going to go with now. I was reading some more papers on this, embryological papers, and it looks like the spinous process has a secondary growth center, and it grows into the fused laminae here. But nevertheless, so we have lamina, and then we have this thing. So this is the sacral articular process, or the superior articular process of S1. It's right here. See that? That's important. That's clinically important. You'll treat a lot of patients who have a dysfunction of this joint. In the living, it would have a pad of articular cartilage right here, just like your knee does, underneath your meniscus. And you can put holes in that meniscus, and you can damage that facet, not meniscus, the articular facet or the articular cartilage can be damaged, and you can start to rub this raw and you'll have chronic back pain. So that's important. It also makes up a little piece. Let's go back to this view. It also makes up a small piece of the part of the arch of bone here, which is called the neural arch, right? So that's the neural arch. You can also see a piece of bone right here. You see that? That actually connects the sacral body here to this arch of bone, and that's called the pedicle. The pedicle of S1 is the only one you can really see. The other ones are all fused together, but you can see the pedicles of S1. There's the other one right there as well. All right, just another view of the superior articular processes right here. If I tip it a little further, so if I put a sticker here, number 5, or what we're using, number 4, or whatever, this is the superior articular process of S1, or the sacral articular process, you could call it. I prefer you call this the superior articular process of S1. If I tipped it down and put a sticker like this, right there, that's the articular cartilage. So I'd want you to say the facet of the superior articular process, which lets me know that you know that's actually part of the joint right there. Over here on this side, that's not part of the joint, right? That's just bone. That's superior articular process. The superior articular process gives rise to the facet, but that's on the other side. Okay? And we'll talk about that more today in lecture. And I think, am I missing anything? I don't think so. I think that's about all I have to say. Might as well do the sacral fossa while we're on a roll here. I think we'll cover some of this again next week. We said, what was that called again? Let me back out so you can see where we're at. Okay, there's the back of the sacrum. We're looking at the side, aren't we? So that kind of looks like an ear, they say. So that's the sacral auricular process. If I tilt it this way a little bit, there's a couple big craters here. Those are sacral fossa, and that's the most important ligament of the SI joint. Actually attaches into these fossa. That's the superior, middle, and inferior sacral fossa. And that interosseous sacroiliac ligament, did I say that? That's what this connects to, and that's the most important ligament of the SI joint. You actually know the other attachment point for this. Does anybody know where that is? The attachment point for the interosseous sacroiliac ligament? You know it. It's the iliac tuberosity. So the iliac tuberosity, which is on your anatomy list, is where the other end of that ligament attaches. All right, so that is Sacrum 101. I'm trying to think if I forgot. I don't think I forgot anything. We did the sacral hiatus. Oh, one more thing. I knew I forgot something. Go back to the sacral hiatus. These things. Let me blow up. These guys right here. What are these bumps? Some people, you can actually feel them when you palpate down by the coccyx. They're big. Those meet up with the coccygeal cornua. So these are the sacral cornua. And the intercornual ligament would connect between these and the coccyx. If we look at this one, this specimen, go back to this one. Let me get it in line here. Okay, there's the sacral hiatus. And then we actually have an ossified sacral or intercornual ligament right here. And we actually have CX1 is broken off. You can see CX1 right there. So that's an ossified intercornual ligament. All right, that's probably enough for your brains. Any questions? Oh, sorry about that. Any questions about anything? That goes over the sacral fossa. It goes in, it plugs into the sacral fossa. That's the interosseous sacroiliac ligament. So it's pretty good, pretty easy because it runs between the sacrum and the ilium. So it's the interosseous sacroiliac ligament. And don't you worry, we're going to be talking a lot about that when we get to the SI joint. Let's look at another sacrum here. You can see the interosseous, or the sacral fossa here. And the sacral fossa would give rise to the interosseous sacroiliac ligament. By the way, what's the matter with this one? And this is not destroyed or anything. How's that one look to you? No, we didn't. I'll get the promontory. Thank you for that. Anybody figure that out? I can see your chat, so you can type in there if you figure that out. What the heck is that? Yeah, missing medial sacral crest. So what does that mean? If the vertebral arch is messed up and not fused together, what do we call that? There we go, spina bifida. So this person has all spina bifidas all the way down. And so that's pretty rare, but it does occur. Probably under 1%, I would say, but pretty rare to get a specimen like that. And then the last thing we didn't cover, if we go back to the sacral base here, you can see the ala, S1 ala. You don't even have to call them that. You just call these the sacral ala. Sacral base. This lip right here is the sacral promontory. And you can't really see it that good unless I try to turn it to the side. And there it's kind of sticking out, right? See the lip? It's a sacral promontory. If people have these spondylopatosises where the bone slips right off the cliff, this usually gives it a little bit extra kind of footing because the other vertebrae don't have that, so it's maybe a little extra protection against something like a spondylopatosis, but they're so incredibly rare. It's hard to know. Can I blow that up? Yeah, now you can see it. Sacral promontory.